I do think the initial version of the vaccine did have some initial efficacy, but the virus quickly mutated. The infection itself leaves behind the spike protein. The severe infection and the very first Wuhan strain, the 2020 strain, which is more severe, resulted in long COVID syndrome, which is due to the retained spike protein. The vaccine is the full length spike protein and much more of it. The spike protein, as far as I know, is the most dangerous disease promoting and lethal protein ever discovered in human medicine, and sadly it's man-made. It was a reckless idea to install the genetic code for the dangerous and potentially lethal spike protein in human beings. The claims that the vaccines save millions of lives are essentially false. Even the pharmaceutical companies don't make that claim. So the politicians are making false pharmaceutical claims. In the United States, that's actually a violation of US law. We would conclude the vaccines have actually resulted in millions of people losing their lives. So we have to get the message out regarding spike detoxification. In my direct observation, it will reliably lower the antibodies to the spike protein over time as a proxy that the spike protein is going away, and patients get better.
Kaum eine Sache hat uns als gesamte Gesellschaft vor so eine große Herausforderung gestellt wie die Covid-Pandemie. Und vor allen Dingen die Entscheidung, ob man impfen sollte, hat Individuen, Familien, Teams, Unternehmen, die Politik, die Medienlandschaft und uns als gesamte Gesellschaft vor diese krasse binäre Entscheidung gestellt. Impfe ich oder impfe ich nicht? Und es ist einfach eine sehr binäre Entscheidung, wo es keine Grauzonen gibt, und das hat uns als Gesellschaft auch sehr, sehr stark gespalten. Manche haben es besser geschafft, die Füße auf dem Boden zu halten, das Herz offen zu halten und den Verstand klar zu halten, und manche sind total abgedriftet, sowohl in die eine Richtung, wo man dann sagt, das ist einfach nur eine absolute Giftbrühe und die wollen uns alle töten und es ist ein riesiger Genozid, aber auch in die andere Richtung, wo man quasi auch den Verstand verloren hat und gesagt hat, das ist auf jeden Fall 100%ig sicher und es gibt keine Nebenwirkungen. Das ist beides natürlich relativ absurd. Also wo ist derjenige, der vielleicht die Füße auf dem Boden gehalten hat, der sein Herz offen gehalten hat, der den Verstand klar gehalten hat? Und es war gar nicht so einfach, solche Leute zu finden. Und einer, der für mich immer dabei sehr, sehr wichtig war, war Dr. Peter McCullough, den wir heute jetzt im Gespräch haben, zu ein paar sehr, sehr wichtigen Fragen, die wir klären wollen. Weil das ist ja auch was die Medienlandschaft der letzten Wochen sehr, sehr befasst hat. Das ist, was durch die Talkshows geht. Es gibt immer mehr Gerichtsprozesse, sowohl für Betroffene von Impfschäden als auch von Long-Covid-Betroffenen. Das ist diese Fragestellung, was war denn jetzt mit der Impfung? Hat das jetzt was gebracht? Haben wir vielleicht zu viel geimpft? Oder haben wir vielleicht sogar noch zu wenig geimpft? Wie Dr. Karl Lauterbach zuletzt noch bei Markus Lanz gesagt hat, wir waren nicht streng genug mit der Impfung. Hat es wirklich was gebracht? Konnten wir Leben retten und wenn ja, wie viele? Was wissen wir jetzt 4 Jahre später wirklich an faktischen Daten? Weil natürlich müssen die erhoben worden sein bei so einer großen, schwerwiegenden Entscheidung. Zweite Frage ist, wie ist es mit Nebenwirkungen? Was wissen wir jetzt 4,5 Jahre später über die Nebenwirkungen, über das Nebenwirkungsprofil? Was haben wir an Daten? Was macht es? Was sind die Mechanismen hinter potenziellen Nebenwirkungen? Was hat es zu tun mit Long-Impfung und Impfschäden? Was hat es zu tun mit vielleicht sogar Long-Covid? Gibt es vielleicht Überschneidungen da? Was haben wir an Daten und vor allem, was können Betroffene jetzt inzwischen tun? Wo liegt der Fokus der großen Behörden und was ist methodisch praktisch inzwischen als am wirksamsten etabliert? Und da haben wir Dr. Peter McCullough als einer der Fachleute genau zu diesem Thema, sodass halt auch Betroffene hier viel rausziehen können, was die konkrete Behandlung dessen halt angeht. Und die dritte große Frage, die wir heute klären wollen, ist, was konnte man denn zur Einführung der Impfung oder zu dem Zeitpunkt, wo die Entscheidung getroffen werden konnte oder musste, was wussten wir da wirklich? Weil jetzt 4 Jahre später ist einfach zu sagen, ja, hätte man. Aber was wussten wir wirklich? Und das ist eine ganz wichtige Fragestellung, nicht nur emotional, sondern es ist auch juristisch eine ganz, ganz wichtige Fragestellung, wo es jetzt genau darum geht, wer ist verantwortlich für zu viel, zu wenig? Wer ist verantwortlich dafür, dass man nicht geimpft hat? Wer ist verantwortlich dafür, dass man geimpft hat? Und dabei muss man einfach wissen, was wussten wir wirklich zu diesem Zeitpunkt? Ihr merkt, ich versuche hier das ganze Thema sehr, sehr offen zu halten und das ist auch immer sehr, sehr wichtig, dass man alle Perspektiven beleuchtet, weil nur so finden wir zu dem, was Wahrheit bedeuten könnte. Und wie gesagt, Dr. Peter McCullough ist einer derjenigen, der das immer sehr offen gehalten hat. Deswegen schätze ich ihn sehr. Dr. Peter McCullough hat auch unter den schwersten Bedingungen über dieses Thema sprechen müssen. Er hat vor dem US-Senat unter Eid ausgesagt, vor dem US-Repräsentantenhaus, hat vor dem Europäischen Parlament aussagen müssen und hat da immer sehr, sehr klar seine Fakten sehr korrekt gehabt. Deswegen schätze ich ihn so sehr als Ansprechpartner für dieses Thema. Er ist im Moment in vielen US-Bundesstaaten als auch vor dem US-Supreme Court eine gefragte Persönlichkeit, wenn es um diese ganzen Gerichtsverhandlungen geht. Ne? Und er ist nicht nur sehr, sehr firm in der Wissenschaft davon, sondern er ist auch praktischer Arzt. Ne? Er ist Internist, er ist Kardiologe, er ist Epidemiologe mit Abschlüssen von der BYU, von der University of Texas, von der University of Michigan und von der Southern Methodist University. Und er hat sehr viel wissenschaftlich publiziert, hauptsächlich natürlich zu den Themen Innere Medizin und Kardiologie, aber jetzt gerade in den letzten Jahren sehr viel zum Thema Covid, Covid-Impfungen, Impfstoffnebenwirkungen und auch therapeutische Protokolle bei bleibenden Schäden von Covid, aber auch von der Impfung. Er hat über 1000 Veröffentlichungen, mehr als 700 Zitierungen in der Nationalbibliothek für Medizin und ist einer der am meist zitierten Wissenschaftler der Welt. Dr. Peter McCullough, I'm so glad you could come on this show, MOJO Change of Perspective, and we're really interested in your perspective on those three big questions. Was there vaccine efficacy? Were there vaccine side effects? And third question, what could we have known? So let's start with the first one. Was there efficacy of the vaccine campaign? What do we know 4 years later?
Well, thanks so much for having me on the program. You know, we need these types of evidence-based reviews of the COVID-19 vaccine campaign all over the country and all over the world because it was the largest public health initiative in human history. Yet, do you know governments have not issued reviews like this? You know, the German government has not sat down and said, let's review actually what happened. Yet this is the biggest thing the German government has ever done in public health. Same thing in the United States. It's an astonishing revelation. Are you aware of any thorough review of what happened with the COVID vaccine campaign in Germany?
No, I am not. There has been some data collected in a similar system as you have in the United States with the VAERS, as it's called in your system. We have a similar surveillance system going, but I haven't seen any official summary of like looking back 4 years now. We have 4 years of data now. What can we say about it? There's been some politicians going through the talk shows in the last couple of weeks saying, well, it was a success. We've saved like 1.6 million lives. That's the number that goes around right now. And there was a politician last week even saying, well, we could have done better. We should have had more harder lockdowns and even more thorough vaccine campaigns, because then we could have saved even 60,000 more people. But there is no, as far as I can say, there is no serious data underlying these statements. So I'm really interested in what your perspective is on that.
Okay, let's go through it. So December 10th, 2020, the US FDA review occurs for the Pfizer vaccine. That was the first one in the United States, and I know the data well. I think the timelines are similar for the other countries. Now, a critical paper published by Michaels and colleagues that accounted for all the deaths in the Pfizer program that should have been known at the time of the December 10th meeting. In fact, they cut the data in mid-November. So the trials were still ongoing when they actually had this meeting. So mid-November, they cut the data, but there were still more deaths occurring. So at the time they reviewed the results, there was actually a few more deaths with Pfizer than placebo. That wasn't a good thing. So then the paper is Michaels and colleagues. That's it can be located on PubMed. Now, the reported efficacy, vaccine efficacy, was a 90% reduction in the incidence of acute COVID-19. But proper clinical trial principles were not used. So, for instance, intent to treat principles were not used. Intent to treat means once randomized, all the infections count, even if someone's not fully vaccinated. But in the clinical trials, I said, no, we're not going to count them until after the second shot of the primary series. So if we actually would have counted that, the calculated efficacy probably would have dropped to about 75%. But having said that, I do think the initial version of the vaccine did have some initial efficacy. And that was against the Wuhan wild type strain. That was the laboratory derived strain from the Institute of Virology in Wuhan, China. But the virus quickly mutated to the Alpha variant in Germany, UK, and the United States, Beta variant down in South Africa. So the variants changed. And by mid-spring, our US CDC was reporting large numbers of vaccine failures, thousands of them, requiring hospitalization and death. So people were hospitalized who were fully vaccinated, and they died. Anthony Fauci came out in April of 2021 and said the vaccines are not working for very long and that we would need to take boosters. So we knew within about 4 months, whatever initial benefit was there, it wasn't for hospitalization and death. In fact, no prospective, double-blind, randomized, placebo-controlled trial ever showed a reduction in hospitalization and death with any vaccine. It's never been shown. And the randomized trial is the only way to make that claim. So even the package inserts.
Quick question, Dr. McCullough. What about the initial trial with the 40,000 people that evaluated whether we can use this vaccine, where they had like this 20,000 people were in the placebo group? What about that? Does that count as a prospective randomized control trial? That's
a prospective. That is the trial to look for.
Right.
And there was no reduction in hospitalization and death. Now, even large comparative non-randomized trials are not valid. And this has been critically analyzed in multiple papers because the authors all took the vaccines, the institutions mandated the vaccines. So the doctors wanted to show the vaccines worked. They, as the vaccines rolled out, healthier people tended to take the vaccines. They were also more likely to seek early treatment, which does reduce hospitalization and death. The virus mutated to milder strains. There was misclassification. So, for instance, in the United States, the most common electronic medical record is probably true in Germany. The default for COVID vaccination is not vaccinated. So if a sick patient went in the hospital, is on a mechanical ventilator, they can't produce their vaccine card. They're just assumed to be unvaccinated. They didn't let the families in.
Okay. Just to clarify this one point really quick before we move on. So there was an initial prospective randomized control trial where they said, well, the vaccine is effective in reducing infections.
Right.
But it's not effective. Like looking at the data, it did not reduce mortality as a whole. So it reduced infections, and we could say was efficacious in reducing infection, but it did not reduce total mortality. Is that correct?
That's correct, and I think that's correct within the bounds of about a few months.
Yeah.
So by April, when our senior COVID advisor said the vaccines aren't working, they're not lasting, and we'll need to take boosters, we know there was a month or two of benefit with respect to just reducing mild infection. Okay, so to summarize, what really reduced the risk of hospitalization and death were natural immunity, prior infection, for sure. Every study has shown that. A great paper to quote is by Chin and colleagues, New England Journal of Medicine, October of 2022. If someone had actually had a previous infection through Delta or Omicron, there was a zero risk of mortality. It's a huge study. Zero risk of mortality, whether you took a vaccine or not. So we knew a couple of years into the pandemic that natural immunity was very, very important in terms of determining mortality. Early treatment, all the studies in aggregate show multiple drugs in combination reduce the risk of hospitalization and death. And then for sure, milder mutations. So the virus got milder. So, mortality, no matter where we were in 2022, was less than 2020, and 2024 less than 2020. So the claims that the vaccines save millions of lives are essentially false pharmaceutical claims. So even if you look at the package insert or FAQ document for the vaccines, there's no claim that they reduce hospitalization and death. United States, if you go in the pharmacy and say, I want a COVID vaccine, how does it help me? In the benefits section, there's no claim that it reduces hospitalization and death.
Yeah, that's important to note. It was never the claim, and there's no data to really show, because like in the last couple of weeks, there have been many politicians going around talk shows in Germany saying we've saved so many lives with the vaccine rollout. The number they threw around was 1.6 million people in Germany. So you say where would that data be, and what would that study have to look like to really show that?
Even the pharmaceutical companies don't make that claim. So if a German citizen went to get a COVID vaccine and looked at the documents that they're supposed to sign, there's no claim that the vaccine will save their life. So the politicians are making false pharmaceutical claims. In the United States, that's actually a violation of US law. You can't say something does has a physical effect on the human body when it doesn't. It's false advertising. Why are the German politicians falsely advertising COVID vaccines? That's the real question.
Yes. That is a really important question. Right now, this is one of the things they say. The other thing they say is we could have saved 60,000 people more if we were a little bit more aggressive with the lockdowns, but also with the vaccine campaign. I don't know where they got this data from.
Well, let's take lockdowns, for instance. That's been thoroughly evaluated. Do you know that in the United States, 97% of Americans got COVID-19?
Mm-hmm.
So it's obvious that masks and social distancing and lockdowns, they all were designed to prevent COVID-19. By the way, the vaccines are supposed to prevent COVID-19. So if all this was successful, we would have had, 90% of the population never got COVID. That would have been a success. But a complete failure is the opposite. Everyone got the illness.
Mm-hmm. And what about the other side of this? Not looking at the effects, but also the possible side effects, because there were many people worried that there could be side effects, and politicians assured us that there wouldn't be side effects, and they even said something like this, right? They have really quotes where they say this vaccine is almost without any side effects. It's a safe vaccine. And what about this claim? And what did the data show now 4 years later?
Well, before we leave efficacy, let me mention recent analysis. And if you go to my Substack Focal Points, we have all the data there listed. We are actually now into negative efficacy.
Oh, wow.
That means the COVID shots taken repeatedly over time, the boosters, make it more likely for someone to get the illness. There's over 6 studies that show that now.
Can you say at what point we started noticing that, or at what point could we have known that? Like when did those studies get published?
At the third shot, it started to happen. So in the United States, the third shot happened roughly September of 2021. And then it became clear the more shots people took, paradoxically, the more likely they were to get COVID. So it's one of the reasons why the majority of Americans are not taking continued boosters. They should be on about the 8th booster now. Probably the same as in Germany. There's a paper by Dexner and colleagues in Germany. Germans aren't taking, 8 boosters now.
No. Maybe 1 or 2 years ago, people started noticing, like everybody and their dog got COVID, and even though they had 3, 4, 5 boosters, and so people just stopped doing it. But there was never like an official statement saying, well, look, we got some data now. We have no efficacy or even negative efficacy. There wasn't any official statement like that, but it was just people noticing and just stopping going for the booster.
Yeah, people were kind of quiet about it. Doctors became quiet about it. Hospitals, the vaccine centers kind of closed down. There used to be a vaccine center in the one of the airports in Dallas. And I used to, I travel a lot to go in the airport. I used to see the vaccine center. No one was in there. There was just a person sitting around, just, probably surfing the internet. And then, after a couple of years, they just one day went away. Most hospitals started shutting it down. But the issue of safety became so big and so daunting that, multiple U.S. states like Texas had legislation put in place so no one could be mandated to take the shot. I mean, there was tremendous resistance. And so can you imagine a vaccine that's so dangerous that states like Texas, and we're one of the biggest states, had to ban the mandate so no one could be mandated to take the shot and then suffer a side effect? I mean, just the fact that that has happened. Do you know in the United States, multiple states now and jurisdictions have legislation to pull the COVID vaccines off the market? So if they were safe, well, why would these municipalities and states even bother with all this? And so that, these are proxies for great concern over what I think is a biological product safety debacle. And I know there's similar concerns in Germany. I lectured in Germany in 2023, and I was in Nuremberg, and huge symposiums, and mainly doctors came forward. It was translated. And I was laying out all the data on safety. And then once I got to questions, these German doctors lined up at the microphone and they gave vignette after vignette. It's like, I didn't need to present any data. They knew the side effects and how dangerous the vaccines were.
Yes. I'm a doctor myself. I practice and we see many people with side effects. I can vouch for that as well. But at the same time, it's just anecdotal evidence. It gets like dismissed a little bit. So, and that's the official narrative in Germany right now, that even some of the states in the United States, they are just involved with dangerous misinformation. You've probably heard that term. So what do we know about like huge data sets or verified data sets, like something we can really use in courtrooms as well, where we can look at the safety signals? What does the data show us?
Well, probably the biggest data set is the World Council for Health Pharmacovigilance Report 2023. Now, that surveilled 39 safety databases worldwide. The big ones are the VAERS system in the United States, the Yellow Card system in the UK, the VIGI database, WHO, and it goes on and on. The report concluded the risk of death after the vaccine is so great that the vaccine should be pulled off the market. So there's over 4,000 peer-reviewed papers on vaccine injuries, disabilities, and vaccine deaths. 4,000 peer-reviewed papers, and these papers have a tremendous, gating to get through. I think there's a lot of bias and even, against publishing such papers. And so I estimate that's probably 1% of reality. There probably should be 400,000 papers published. And I'm an editor of of an international journal. I know this business well. So let's take the VAERS system, the Vaccine Event Reporting System in the United States. The only people who report to VAERS are largely healthcare workers who have determined the vaccine has caused the problem, because we have very severe fines and imprisonment if we have false reporting or anything that could look like spurious reporting. So all the deaths that I've reported, I am certain the vaccine caused the death. And so you have to look at the data and understand, boy, that's pretty certain. Causality is confirmed with VAERS. So where we are with Americans now is we have 19,400 or so vaccine deaths and in VAERS. Now, of those, about 1,175 occur on the same day they take the shot. It's nearly instantaneous or a few hours later. Another 1,200 die the next day. So it's very tightly temporally related in this reporting scheme. Now, in FDA testimony, there's been experts that have testified over the course of the campaign. The agreed upon underreporting factor for COVID vaccine deaths is 30. Now, it could be lower, it could be higher, but 30. But 30 times 19,000 comes up to about 560,000 Americans who have died after COVID-19 vaccination. That's the estimate. So no, the vaccines didn't save millions of lives. In the United States, they've cost people their lives. And if this is true all over the world, because it's the same product, we would conclude the vaccines have actually resulted in millions of people losing their lives.
What is the cause for the underreporting? I know in Germany, one of the causes for underreporting, we have this PEI register. So every time we as doctors see possible side effects, we are supposed to report to the PEI. But this is like really complicated process. And I know many doctors do not have the time to take out of the day, especially when they're like in intensive care units or anything like that. It's very like high fluctuation to really report everything. And even considerable, like within 2 weeks, it could be considered a vaccine side effect. But what when somebody has issues 3, 4, 5 months down the road, and we can talk about mechanistic possibilities of what the vaccine could maybe induce, that could have issues months down the road. So what is your perspective on the underreporting, and how can we like gauge whether that underreporting is true or even like higher or lower?
So underreporting has been evaluated, and I know a lot about VAERS because I make a lot of reports. About half of the reporting entries on the internet for VAERS are about the doctor, by the way, about half. Name, address, phone number, how to contact. I mean, believe me, when you report to VAERS, one is really exposing themselves professionally. There was a very high profile case of a physician assistant. Her name is Deb Conrad, and she was at a hospital in Rochester, New York, and she was dutifully reporting these deaths to VAERS in 2021. She was fired for doing that. And it became well known that if a healthcare provider reported to VAERS, they could lose their job. So I think one of the biggest reasons why there's no reporting is not time. It's not time or not concern. It's actually fear of losing one's job. Then, of course, there's also the fear of federal fines or imprisonment. And then, to me, a big barrier is we have to have the vaccine card. So when someone dies at home and they're taken to the coroner's office or just taken to a funeral home, I would have to, A, find out about that, get the circumstances, and then get the vaccine card. That's virtually impossible to do. You're right. Most of the VAERS reporting is within a couple weeks, by and large. Now, according to FDA guidance for new products, any death within 30 days should count as, due to the investigational product. I've chaired over 24 data safety monitoring boards. I can tell you any death within 30 days, I don't care what the circumstances are, we should attribute that to the new product. For example, let's say someone dies in a motor vehicle accident at day 24. How could that be due to the vaccine? Well, maybe a patient had a seizure or they had a cardiac arrest driving the car. So any death is due to the vaccine. I'll give you another scenario. Let's say within 30 days, the patient had a elective hip replacement surgery and they died of a blood clot, a pulmonary embolism. Well, yeah, that should count against the vaccine. The vaccine is known to cause blood clots. So, the known mechanisms of disease allow one to determine that the vaccine is the cause of the death.
Yeah, let's talk about those known mechanisms. What are the supposed mechanisms of side effects? And can you give us for each mechanism maybe a level of certainty? Like how certain are we that this is really a mechanism of side effects?
Well, let's take the one that all the regulatory authorities agree on. So it's in the package insert for the, in the EMA and the US FDA. They all agree the COVID vaccines cause myocarditis or heart damage. That one's clear. That one's not ambiguous. It's not controversial. The vaccines cause myocarditis. There's over 400 peer-reviewed papers on this. The myocarditis is fatal. This is heart inflammation, and it is fatal. the paper that nailed this down, that it can be fatal, is published by Hulscher and myself and colleagues, and it was published in the European Society of Cardiology journal, one of the best journals in cardiology. So it's clear that COVID vaccines cause heart damage, and the heart damage leads to death. Now the question is, how big is this? And the myocarditis, or the vaccine myocarditis, the acute myocarditis that's detected typically within a couple weeks, produces chest pain, dramatic EKG changes, elevations in blood tests called cardiac troponin and other tests, heart arrhythmias, heart failure. It causes at least 90% of the victims to be hospitalized. And being hospitalized for sure meets the definition of a serious adverse event. So it's serious. But that acute myocarditis occurs mainly men age 18 to 24. Well, there are two prospective cohort studies, which is the only way to evaluate incidence. One by Mansugian, the other one by Bergen from Switzerland, showing the rate of heart damage is about 2.5%. That's how common it is. So at least we have that 2.5% number. That's for something that's evident. You can find
2.5% per vaccinee or per vaccination?
2.5% per shot.
Per shot. So not per person, but per shot.
No, per shot.
Oh,
the
wow.
Mansugian was on the second shot. The Bergen was on the third shot. Okay, so 2.5% per shot. Now there's this entire vast area of what's called subclinical myopericarditis. So there's a much larger fraction of people who have chest pain, palpitations, swings in blood pressure, we call POTS, or posterior orthostatic tachycardia, atrial fibrillation, premature ventricular contractions. Now, a recent paper from Japan in the Journal of the American College of Cardiology has shown that there are microscars in the heart from the vaccine. And it would never be picked up on a cardiac MRI, would never be picked up with cardiac troponin testing. And then we have data from Crossan and colleagues showing Pfizer and Moderna messenger RNA are physically in the heart. They are physically get stuck in the heart muscle, and data from Baumeier in Germany showing the spike protein from the messenger RNA is in the heart, causing heart damage.
It shouldn't be there, right? That was one of the things.
Should not be there. We should not have any foreign genetic material or foreign protein in the heart. It's going to cause inflammation, and then the inflammation can lead to cardiac arrest or heart failure.
That was one of the things that was really hammered down by politicians, by media people, that the shot is going to stay in the arm, right? It's going to be gone within days. Like we had one woman from the ethics committee in Germany. She was always repeating that point that nobody should worry because it's going to stay local. It's going to be gone within days.
Well, we learned, Baumeier had young men in Germany hospitalized, was doing biopsies. Now Jonker from Harvard has a paper in Circulation showing that, again, young children damaged with vaccine myocarditis have circulating spike protein that's not bound up appropriately by antibodies, whereas children without myocarditis, the antibodies are appropriately binding the spike protein. So part of the mystery of who gets myocarditis and who doesn't is who actually gets enough of these neutralizing antibodies. Again, this is just in the peer-reviewed literature. This is, very, very solid evidence. Now a paper from Brogna and colleagues from Germany again, the German audience here can just find these citations and review them, using mass spec has found circulating spike protein, the full-length spike protein produced by Pfizer and Moderna. It's held in the pre-fusion conformation. It twists into groups of 3, trimerizes. It's in the blood of the vaccinated, at least half of them, for 6 months. Now a paper from Yale using what's called the SPEAR assay found spike protein circulating out to 709 days. Can you imagine taking a shot and then having a foreign, dangerous, pathogenic, potentially lethal protein circulating in the blood for, over 6 months? I mean, the plausibility there for causing medical problems is very high.
Yeah, I mean, it's got pretty soon, even during the campaign start or soon after, it became really clear that the spike protein is the really toxic part of this whole virus. So what is your perspective on the toxicity of it? Like, what does the spike protein do? As you say, like, it's circulating in the vaccinees for months and even years, maybe. What are the effects of the spike protein? What does it do in the body?
It was a reckless idea to install the genetic code for the dangerous and potentially lethal spike protein in human beings, and to do this into billions of people. Never have we installed the foreign, long-lasting genetic code for a lethal protein in human beings. It's never been done before. Even the tetanus toxoid is exactly that. It's a toxoid. It's not the lethal toxin. It's a benign form of a changed protein. This is an incredibly reckless idea. First off, the genetic code, whether it's messenger RNA or adenoviral DNA, there's no information about how long it lasts in the body at the time these were released. Now we know that messenger RNA has been found in lymph nodes for at least a couple months by a paper from Stanford by Roklin. It was found circulating in blood by Castriuta at least for a month. Can you imagine having foreign messenger RNA circulating at least for a month in the bloodstream, producing the spike protein? But because it's still produced and circulating at least at 6 months, the messenger RNA may last that long or longer. Now, the spike protein for sure damages cells. It gets inside cells. It impairs mitochondrial function inside the cells. It's expressed on the cell surface, so the body attacks itself, so it induces autoimmunity, for sure. The spike protein suppresses certain aspects of the immune system and leads to a syndrome called vaccine immunodeficiency syndrome, which is an official term of reference in the Australian inquiry into this debacle. The spike protein for sure causes blood clots, for sure. It's been found in blood clots. In vitro studies show it incites blood clotting, even in the absence of platelets, which is remarkable. For sure, the spike protein folds and forms what's called amyloid. Amyloid is a rubbery substance. That's been shown in the brain of those who've taken the vaccine. It's been shown within blood clots of people who've suffered blood clotting complications. The spike protein, in a paper by Singh and colleagues from the University of Pittsburgh, stoichiometrically probably impairs tumor suppressor systems, P53 and BRCA. These are major, cancer prevention systems in the body. The spike protein, as far as I know, is the most dangerous, disease-promoting, and lethal protein ever discovered in human medicine, and sadly, it's man-made.
That's wild. That's many have suspected this. Many have seen this coming. Now the data seems to be out and pretty clear on this. I know you have been on the forefront also of not only pointing the finger at the problem and putting the finger in a wound, but also being the one with the healing impulse. Like you've also had many impulses on, hey, look, this is what we could do, this is what we can do. What can you say on that front? Like, what do we know now on how to treat this and how to help people who have this?
Well, to be fair, the infection itself leaves behind the spike protein.
Yeah.
Now, in the papers from Bruce Patterson at InCellDX, it's not the full spike protein. It's just the S1 segment. So by review, here's a virus. The spike protein is the spine on the surface of the virus. So just the very tip is retained in the body after the infection. But Patterson did report that tip is found in CD16 positive monocytes for at least 15 months after the shots, particularly in patients with long COVID. Now, the vaccine installs large quantities of the full spike protein. So almost certainly.
So to be clear, like, can you restate that? What is the difference between having the infection and the vaccination, also in terms of the long-term toxicity effects that might happen?
The infection, particularly the severe infection and the very first Wuhan strain, the 2020 strain, which is more severe, resulted in long COVID syndrome, which is due to the retained spike protein. That's clear now. And it's the tip of the S1 segment, and it incites inflammation. The cells try to bind it up. So most of it is not free. It's actually just bound inside white blood cells as they're trying to catabolize it. But the point is they don't properly eliminate it. So even the S1 segment must be resistant to proteases. This is a very important observation. The vaccine, it's the full length spike protein and much more of it. So if we were to measure antibodies against the spike protein, which is a proxy for how much is still there stimulating antibodies, and I have experience in thousands of patients where I've done this. The antibodies against the spike protein in somebody who's had the infection could be 1,000. Maybe somebody who's had multiple infections, long COVID, could be 2,000 units per ml. Someone will take the vaccine with the full length spike protein. We see 5, 10, 15, over 25,000 units per ml. So tons of antibodies against the spike protein as a proxy that the body's been exposed to so much more of this. Mm-hmm. And because it's found circulating in blood for 6 months, there must be continued stimulation of the immune system. Mm-hmm. Okay. So the spike protein, because it doesn't seem to be cleared from the body, and it probably has prolonged production from the vaccines, needs to be addressed. And, the Biden administration in the United States spent $1 billion on long COVID syndromes and did not, in a single research project, study the spike protein. In fact, the spike protein is not even mentioned in their report.
Wow.
Can you imagine studying a problem and no one actually even measured or looked at or mentioned the cause of the problem?
That is pretty insane, because that seems to me like in 2021 it was already pretty clear that the spike protein has inherent toxicity.
Not a single project measured antibodies against the spike protein, measured the spike protein itself, mentioned the spike protein as the cause of the problem.
That's wild. Do you think that's because when they do that, they would open a whole nother can of worms?
Well, if one starts studying the spike protein as the cause of long COVID, they would also lead them to the fact that the vaccinated have spike protein leading to vaccine problems.
Right.
So that's the reason why. Do you know most medical centers in the United States will not measure antibodies to the spike protein?
That's insane.
Because it leads to the vaccine. Now, There's been a breakthrough in Germany, a group, and you can find them on the internet. They're called INMODIA, INMODIA. They're accepting samples, and they'll actually, directly measure the spike protein. So if you can put INMODIA in your notes, this is brand new. Listen, this is brand new, and
I will. I've been working with a lab that has been doing that for quite some time now. Or what's the difference on this new test? I've working with the IMD.
Well, they will measure. They'll stain for spike protein in tissues. It's a pathology lab, and they'll directly measure spike. In the United States, we can't directly measure spike. The closest we can do is do the InCell DX test with Bruce Patterson for the intracellular, and so we greatly need a spike mass test to.
Oh, okay. That's the difference. So what we've been measuring all those years was more the antibody.
Yeah.
Okay.
So you're probably doing what we're doing is measuring. We're using the Roche Elexis system.
Yeah. Okay. So in the INMODIA, the new one, they directly measure the spike.
Right.
Got it. Okay.
Right. So they need samples. So anybody listening to your show, and I've encouraged my U.S. patients to get in touch with them and get samples over to INMODIA. Okay. Now,
they do like tissue samples as well, right?
Tissue samples.
Of all the tissues that might be involved. Yeah.
Right. So if there are tumor histopathology samples, autopsies, things like this.
Cool. Yeah.
Now, you asked what to do about the spike protein. Well, if it's a protein and the body can't break it down, then it doesn't matter how much we try to manage inflammation or supplement with vitamins or other things. It's not going to solve the problem. We have to get rid of the spike protein. And so there in 2023, we had two seminal publications, and it's now copyrighted, McCullough Protocol Base Spike Protein Detoxification. And this is the combined use of 3 natural ingredients, nattokinase, bromelain, and curcumin. 2 of them are proteolytic enzymes, and it's taken in capsule format, and this will reliably dissolve the spike protein in cell and cell lysate models. In my direct observation, it will reliably lower the antibodies to the spike protein over time as a proxy that the spike protein is going away, and patients get better from these chronic syndromes that they've had for years. Now, the caveats are you have to take a lot of the enzymes, and they have to be taken for a long period of time on an empty stomach. So we've worked hard to bring like a viable product to market, and I'm the chief scientific officer of the wellness company, and our lead product out this year is called the Ultimate Spike Detox, which is high dose nattokinase, bromelain, and curcumin. And it's taken 2 capsules twice a day on an empty stomach. That would deliver 8,000 fibrinolytic units of nattokinase. And I commonly double that in my practice, 4 capsules twice a day. So we're getting to 16,000 units of natto, well over 1,000 milligrams of bromelain. Those are the proteolytic enzymes. Jordan Vaughn.
One quick question in terms of the proteolytic enzymes. What is the risk of bleeding for people who take this in such a high dose?
Yeah, there is a risk of bleeding because nattokinase is thrombolytic, and then bromelain is antithrombotic. So bromelain itself prolongs the prothrombin time. So there is a risk of bleeding. And, I always give the caveat that it's largely mucosal bleeding, like at the gums or the nose, or easy bruising. And we know the safety limit on nattokinase is at about 80,000 units a day. So we're well below the safety limit. But if patients, I've had one significant bleeding event in my practice. It was a man with liver disease. And, we have to caution patients on various forms of anticoagulants or blood thinners, but we do use it in addition to blood thinners like apixaban or rivaroxaban or dabigatran or even warfarin. Mm-hmm. And I've used it at high dose. But, there is the caveat of bleeding. So we certainly give patients that caveat, but it's acceptable. And in my experience, we just will not get rid of the spike protein. Remember, the spike protein is making people prothrombotic. So one of the first things I ask patients is, do you have any bruising? And the vaccinated will tell you, no, I never get bruises because they're so procoagulant.
Interesting. And do you consider the antibodies as a good proxy of really treatment success? You mentioned that, and that's interesting because that would help the doctors in a day-to-day practice to really have a really easy monitoring device.
Sure. So, and we've published this. We've published a case of a refractory case of vaccine myopericarditis and heart failure, a young man, and his antibodies went from 12,000 down to about 2,000 on very intense spike detoxification. But it took over a year. Mm-hmm. And in general, because the antibodies, don't forget, are just a reflection of the immune system. So we'd want to see about a 20% reduction in the antibodies as a proxy that the mass has gone down. In this case, he had 80% reduction. He's almost certain that the mass of spike protein has gone down in his body, and he clinically got better. But my advice is, wait 9 months to a year to recheck the antibodies to be sure they've gone down. Now, some people are unmeasurably high, over 25,000 units. And on the Roche assay, so it may take a while for that to come down. So I think the duration of spike detoxification, and again, the lead product is Ultimate Spike Detox from the Wellness Company. You can look at the ingredients, by the way, and buy these separately, but in Germany, you can get it on Amazon. The duration has got to be a year, and if well tolerated, until we know more, probably want to extend that indefinitely right now. I've seen new blood clots and cardiac arrests occur from people who took the shots in 2021, and the cardiac arrests are occurring in 2025, for instance. So it's greatly concerning. So we have to get the message out regarding spike detoxification. Now, recently a paper was published by Dr. Shirasawa in Japan. I've had him on my show. You can check out my Substack Focal Points and talk to Dr. Shirasawa. I listened to it. He had a man who had bilateral carotid thrombi. seen by imaging, and he was having brain fog. He took 4 Pfizer vaccines, and he gave an intense blend of enzymes 3 times a day. And it included nattokinase and bromelain, but also papain, lumbral kinase, sereptase, and others. And then he demonstrated through serial imaging dissolution of the blood clot and resolution of the syndrome. So Shirasawa was able to do that in about 4 months. But to me, it's clear we need a proteolytic detoxification approach. Others are trying to say that nicotine alone will do it, or ivermectin, or hydroxychloroquine, or naltrexone, or Paxlovid. In my experience, none of those strategies, and I've tried them, none of them are successful, nor would we expect them to be successful, because they don't help the body dispose the spike protein.
Mm-hmm. What is your perspective on ivermectin in long COVID, long vaccination cases, spike protein syndrome cases?
Yeah. Ivermectin is not part of the base. The base is nattokinase, bromelain, and curcumin, but ivermectin is an adjunct. And in my experience, and I have more now, I think, than anybody in the world, I directly see these patients, ivermectin is appropriate. And when I prescribe it high dose for 90 days for the craniofacial syndromes like trigeminal neuralgia, loss of hearing or sight, anosmia, persistent pulmonary symptoms, the ground glass appearance, and then skin rashes. The skin rashes are typically not responsive to steroids, but they do respond to ivermectin. So I do use ivermectin in my practice, but it's largely, I think, for persistent SARS-CoV-2 replication. That's actually probably what's causing it. And ivermectin is effective in shutting down replication. It blocks the viral entry into the nucleus. It has some antagonism to the spike protein. It changes inflammatory factors and is very safe. So I think ivermectin plays a role.
High dose would be 12 milligrams or even higher?
Oh, yeah. No, someone your size would probably be 48 milligrams.
Oh, wow.
Yeah, big man would be 60 milligrams. So we go hard on the dose. If I'm going to use it, I'm going to use it at a high dose for about 90 days. But it is a fraction of the long COVID patients get ivermectin. Maybe it's 25%. But they get it in addition to the nattokinase, bromelain, and curcumin.
Yeah. Awesome. Thank you for that. Thank you for pushing this protocol and being so vocal about this. I know this hasn't been without backlash, and you've really fought hard battles, and thank you from the heart for that. And
Doctor, think about the alternative. We don't have any protocol from Munich or Berlin. I mean, where's Charity Hospital? They're renowned. Karolinska has no protocol for this. Neither does Harvard. Neither does the Mayo Clinic. So think about the alternative. There is no alternative. The medical orthodoxy has nothing to offer these patients.
Yes, I know.
So it's when I went on Tucker Carlson early in 2021, I had published the McCullough protocol, early treatment for COVID-19, the most widely used protocol in the world to treat COVID patients. And I told him, I said, Tucker, Harvard doesn't have a protocol. He goes, you got to be kidding me. You'd think some institution would want their name as on the protocol that treated the biggest problem in human history.
Yeah, I know.
You'd think they'd want that. I mean, think about the competition. You'd think that medical centers would want to be the most excellent in treating and solving the problem of long COVID and vaccine injury.
Yeah, I know.
It's mind-boggling.
It's completely wild, and that's that gives you like thoughts, and you've come in touch with things that you wouldn't know before that you would come in touch with. I completely see it. I'm trained in neuroimmunology, so relationship between nervous system and the immune system, and I'm more on the preventative side. So when COVID came about, we're like, hey, let's look at the data, and we saw, look, like people with insulin resistance and pre-diabetics and diabetics, they get affected the hardest. We see dyslipidemia getting more affected. We see age being more, and some immune, like chronic inflammation, they get more problems with this, right? So we were like, hey, this is something we could do something about this, like with omega-3 fatty acids, with some more movements, some dietary changes that are really evidence-based. And we're like looking around the German official publications, from the Robert Koch Institute, for example, or the German Institute of Health, and they didn't publish anything on this. And I called them. I called the Robert Koch Institute. I was like, hey, look, there's the virus, but there's also the person. And we know within the person, there's some risk factors we could really address. How about you put out a PDF or anything, just like something small?
Right.
And they told me on the phone, like, we don't care about the person. We only care about the virus. And I was like, oh, well. So then we took it in our own hands, and we went into the preventative side. We did something that's called the immunosignature. We taught people how to take like simple blood markers, the lipid profile, the insulin resistance markers, and then have individual treatment protocols to be on the preventative
Excellent.
side.
Yeah.
And we got similar backlash, right? A lot of people loved it, but we also got some backlash. And just like you said, we doctors had to take it in our own hands, and we did it on a small side. You did it on a really big scale, and I applaud you for that. That's awesome.
Yeah, but think about this: the Robert Koch Institute. I mean, this is the biggest problem they've ever faced as an organization, and they have no organized approach. They had no organized approach in 2020 on how to tackle severely ill patients with COVID-19 or prevent COVID-19 in the population in general in 2020. And they have nothing for long COVID. I mean, think about a void. Historians are going to go back and look at this and say, why did they have a complete loss of all of their clinical excellence? They wanted, Robert Koch wants to be world famous in data analytics and outbreak analysis, and suddenly they're completely useless for the biggest problem on the world stage. The same thing with our major agencies in the United States and our blue ribbon organizations. It's astonishing.
Yeah, it's astonishing. It's an institutional failure on a huge scale, and also kind of like a decoupling between the theory and the actual practice. Like people like you and also people like me, we saw in practice, like, hey, this is what we see and this is what we could do about it. But on a theoretical scale, it's easier to just track numbers of PCR results, and they just focused on that side, and maybe, in my perspective, lost track of the whole individual and the people and what we can really do about this.
Yeah, and they certainly didn't prioritize the important outcomes. The outcomes were hospitalization and death.
Right.
So from the very beginning, the messaging should have been, listen, this is really contagious. We're all going to get it. Let's not waste our time with lockdowns and masks. Or remember contact tracing? Remember all the efforts done there? People forget about that. I mean, what a waste of time that was. We should have been told we're all going to get it. We're going to take special measures to prevent hospitalization and death. We're going to use risk stratification. Even the very early versions of McCullough protocols published in the American Journal of Medicine in 2020, August of 2020, the very first step in the protocol is risk stratification based on age and multiple comorbid factors, obesity, diabetes, metabolic syndrome. You've mentioned them.
Yes.
So, even to this day, Koch Institute and the NIH, CDC, and FDA, they actually don't even factor in risk stratification. And you know that because for the vaccines, for instance, the biggest push on the COVID vaccines is for 6-month-old babies. And there's not a push for the vaccines. Even if you thought the vaccines worked, you'd think the continued push would be in nursing home patients. Like, my mother is in a senior home. She's in a nursing home in Dallas. They have not mentioned the vaccines there for years.
Yeah.
So if they're not vaccinating seniors, why are they mandatorily vaccinating 6-month-old babies, for instance, in Brazil? It's a mandate in Brazil.
Yeah. It seems it's completely about something else, because like you mentioned this really important point, like we've lost the target outcome, which should be total health, overall mortality. How can we save people from dying and becoming severely sick? But we've lost it. Like from the get-go, we had our focus on, or they had their focus on, how can we reduce infection? How can we reduce PCR numbers, right? And we might have reduced PCR numbers, we might have reduced infections, but overall, have we really reduced sickness and death, as you mentioned? And we probably lost that target out of our eyes from the get-go, and we probably did more harm than good.
Yeah, there are over a dozen studies now showing all-cause mortality has gone up, particularly after 2021 with the rollout of the vaccines. 12 studies, 12 period studies. Ed Dowd in the United States has actually written a whole book on this from all the life insurance data tables. All-cause mortality after a pandemic should go down because of a culling effect of the vulnerable, particularly seniors who died at the end of life. We shouldn't have all-cause mortality. It's actually going up in young people, in middle-aged people. That should not be happening after a pandemic. Greatly concerning. Yeah.
It shouldn't. Greatly concerning. And I personally want to see lawsuits. I want to see this discussed in a courtroom. I'm not saying this or this or this guy is guilty. I'm not the guy to do that. This is what people in the courtroom do. But we need to have this discussion in the courtroom. Like right immediately, we need this for the patients. Like I treat so many patients and they are fighting these fights right now. These people have been harmed by the vaccine. They go into the courtroom and right now they basically get smashed down in the first one or two instances because no, the vaccine saved so many lives. So let's not discuss this issue, right? So they get smashed down. But by more and more publications coming out and by people like you really advocating for this topic, their chance of really getting reimbursements in the courtroom grows. And I'm really happy to see that. Like I'm starting to get the first patients that get recognized for having a vaccine injury.
Oh,
and they get social help and they get money for their treatments, which is really, really important. And we're having these courtroom discussions, and one of the things that really comes up in those courtroom discussions when it comes to liability is well, we could not have known. So maybe let's get to that last part of those three questions I had initially, like what could we really have known? Because the German government, the vaccine manufacturers, they basically say, well, we could not have known. It was like a severe acute threat. There was this big infection going and we had to do this and nobody could have known. So what is your perspective on this? Could we have known?
Yeah, you'll hear this among those who have promoted the vaccines. They'll say, listen, we now acknowledge they're not perfect. And, sadly, some people had to die with the vaccine. And they'll just say, listen, it's almost as if we're at war and there had to be collateral damage. War terms are used like emergency countermeasures. That's a military term for the vaccines. What we know is that I published an op-ed in The Hill. It's the most widely read journal for the House, the Senate, and the White House in August of 2020, before the vaccines came out. And the title of it was The Great Gamble of the COVID vaccine development program. That op-ed alone, I should have had senators call me. I should have been called to the White House. People said, listen, I was the only public figure in the world who questioned the vaccines before they came out. That should have, myself and Scott Atlas, who became a White House advisor, we were the only two doctors writing op-eds in The Hill. So, one of the two major doctors informing the government is concerned about the vaccines before they came out. But yet there were no calls, there was no alarm bells going off, and there was such enthusiasm for the vaccines. And when I testified in the U.S. Senate,
and even Scott Atlas, I read his book, which is a fascinating book. As far as I understand him, he wasn't as vocal maybe publicly, but he had his concerns too, right?
He had his concerns, but no, he took the vaccines. I know Scott well. Initially he thought the vaccines saved lives. He has changed his mind now. By the way, Dr. Bhattacharya, who now leads the NIH, he took the shots. His wife did, his kids did. Marty Macri, who heads the FDA, he took the shots. He pushed the vaccines, even for pregnant women. So believe me, Dr. Oz took his shots on TV. He's leading CMS. I'm the only public figure in the world. Even Robert F. Kennedy did not make noise about the COVID-19 vaccines before they came out. It's really astonishing. The whole world was kind of in a trance. But I was neutral on the vaccines as they came out. I never recommended them. Never recommend. You can't find a single video where I told somebody to get vaccinated. I didn't take the vaccines myself. My wife didn't. Warned my family. My mother in the nursing home did not take the vaccines. Warned her, she's fine today. Warned her about them. By March of 2021, we had 1,600 U.S. deaths by March of 2021. And the CDC put a very brief statement on their website and saying that CDC and FDA doctors reviewed these deaths and none of them were due to the vaccine. I knew that had to be a false statement because I've led adjudication panels in the past. To review 1,600 deaths would have taken many months because we have to get the death certificates in the laboratories and the circumstances. There's no way they could have ruled out the vaccine in every death. And people were dying right in the vaccine center. In fact, there were so many deaths in the vaccine center that they had to have emergency equipment brought into these vaccine centers. So we, it was obvious the vaccine was causing death. So I testified in the Texas Senate March of 2021 on record expressing grave concerns regarding the COVID-19 vaccines. We were 3 months into the campaign. 6 weeks later, I was on Tucker Carlson Today. That's a show that, was watched by many millions of people. In fact, that show led Tucker on an inquiry that ultimately lost his job at Fox. So believe me, the alarm bells were going off at least a few months into the campaign. Looking back on it.
What made you initially doubt the vaccine? And what made you initially hold back with your recommendations on this or neutrality?
Right. The first is that the vaccines, at least the first one, Pfizer, Moderna, they were the genetic code for the spike protein. Again, this is a disastrous idea. We've never given foreign genetic code. And it now turns out we've realized it's pseudo-uridinated, it's synthetic, it's not easily broken down. We've never given this to human beings. There was no genotoxicity, no teratogenicity, no oncogenicity, preclinical testing. The spike protein we knew was lethal. How would we shut off the genetic code? It was a very, very bad idea from the beginning. My initial op-ed didn't focus so much on safety. I just didn't think it was going to work because, we give an injection in the arm. They're largely ineffective against respiratory diseases like influenza. The influenza vaccine is notoriously ineffective. So I just basically thought they wouldn't work. But when I testified in the U.S. Senate, November 19th, 2020, the very last question was, did our panel have any questions, any concerns regarding the COVID-19 vaccines? And they were just out by press release. And so we are at the end of the hearing on early treatment, and all of us remained silent. Myself, Dr. Harvey Risch, and George Freed. I regret that silence. I was wearing an N95 mask. I should have pulled my mask off and said, you know what, I've got grave concerns over the vaccines. But we just remained silent. We understood what a contentious issue this was going to be. And sure enough, we now know, 2 years later, the Pfizer 90-day safety dossier was released under court order. And Pfizer had collected 1,223 deaths with the COVID vaccine from family members who were concerned, and healthcare providers, that the Pfizer vaccine was the cause of death. Pfizer should have shut this down at 5 deaths or 10. No more than 50, not 1,223 and keep it buried for a couple years. And the FDA wanted to bury it for 55 years in the courts.
That's the thing that I find almost as a smoking gun, because with all the other things, you could always kind of argue, but there's a super dangerous virus, like preventative paradox, right? We could have saved so many, you could always argue this, but this intransparency and this holding back of data and this we're not telling you about this and that. And there's more people dying in the vaccine group from heart problems, even though we reduced the infections in the vaccine groups. Well, it's kind of like this intransparency.
Can you imagine if by March 1st of 2021, if Pfizer said, listen, here's our 90-day dossier, we gave it to the FDA, Pfizer did a press release and said, listen, we've got 1,223 deaths, and we are leaving this up to the regulatory agencies to say, how should we change the consent form? How should we present the risks and benefits? We do want people to know that death after vaccination can occur, and it's occurring in large numbers. If there was some transparency, the vaccine program could have been represented with risks and benefits. But, within a few months after that, the vaccines became mandatory for many places of employment, the military, universities, etc.
You probably know Christian Drosten, who was one of the main figures in Germany, inventing the PCR test for the COVID vaccine for the COVID virus. And he came out 2 or 3 weeks ago saying, the public is not smart enough. We had to kind of like do this. We had to communicate this way. We had to basically come up with the mandates instead of like giving the full transparency because the public is just not smart enough. That was, I mean, I wasn't surprised in a way, but I was surprised that he really said it this way. We always suspected it this way, but he said it this way, and that was really intense.
Well, think about the hubris, the arrogance, the paternalism here. This idea that government agencies know what's best for people, and they're too simple for them to figure this out for themselves. And yet this inherent risk of death, people went to the vaccine centers and they lost their lives. It's just absolutely a tragedy. You know, there's a vignette. When the very first booster came out, there was a nurse in Canada, and she had gone to the pharmacy to get her booster. She had to because Canadian hospitals were requiring it. And she was texting her daughter. And, you know, the risk of death is so high that after one takes the shot, they have to stay in the vaccine center and be observed for a cardiac arrest. And they have to be ready to do shock. Well, sure enough, she was texting her daughter. Then the text stream ends and she has a cardiac arrest and loses her life. I mean, these are well documented. And still to this day, the consent form says you may have a cardiac arrest and lose your life. Now, people are told to wait in the vaccine center, and they have all the resuscitation equipment there. I mean, it should be obvious, but it should be stated as a written risk.
Yes. I mean, we as doctors, we basically see that almost weekly, what this can do. The public seems mostly unaware of this, at least in Germany, because we have this added issue. I don't want to go into depth of this, but we have this added issue of censoring, like things get censored away from YouTube, from Google, and we saw it on Facebook, and the general public seems mostly unaware. The biggest hope I have is in the courtrooms. There's a lot of happening right now. Next week, I have an interview with one of the guys in Germany who is really involved in the courtrooms. What's happening on this front, and there seems to be this current discussion, like what really could we have known, and what does the data really show? And I'm very hopeful that we get some really interesting courtroom decisions. What is happening in the United States on that front? Are you involved in any of those big legislation issues?
Yeah, I've been involved in over 100 cases, court cases. 2 have gone to the U.S. Supreme Court, 1 to the Texas Supreme Court. So there's plenty of legal activity. And by the way, YouTube censorship has been dropped now. So I've posted dozens of videos that previously would have been immediately struck off YouTube, and they're surviving now. So definitely post this on YouTube. That's awesome.
When has this been? When did they drop this?
Within the last month.
All right, awesome. That's cool. That's good news. Dr. Peter McCullough, I thank you for your time. I thank you for everything you've done the last 4 or 5 years. I've been watching you. Every time I read your name online, I'm really clicking on it. You always have something good to say, something positive to say. You always have something that patients really benefit from. We're going to put all your resources down in the show notes, where you have all the references that you've referenced today, where people can find your protocol, can find your spike protein detox protocol. And yeah, so thank you from the bottom of my heart for everything you've done, and I wish you a great week.
Thank you so much. Make sure to follow me on Focal Points, Substack. Follow me on social media, X, which would be P_McCullough MD. And then, of course, take a look at the Wellness Company. They're the leading company that's following innovative solutions available to Germans, I believe, through Amazon or direct order. And make sure you tune in my podcast, America Out Loud Talk Radio, McCullough Report. Thank you so much for having me.